Good morning, everybody, and welcome to the healthcare track of Insight 2020. This is Pranav Rao from Smartkarma's research team, and I'm pleased to introduce Dr. Guotong Xie, the Chief Healthcare Scientist of the Ping An Group. Dr. Xie is the leader of the R&D team at Ping An Health Technology. Before joining Ping An, Dr. Xie was the director of IBM Research China, China's cognitive healthcare department, and co-led the IBM Global Healthcare Strategy. He has more than 15 years experience in artificial intelligence and applying these technologies in the healthcare area. He has published more than 50 papers in international conferences and journals and has won 30 patents and 3 IBM Outstanding Research Awards. He was also awarded the Outstanding IBMer Award in 2016. Dr. Xie, it's a pleasure to have you on. I'll be sharing my screen with your presentation, and we can kick off when you're ready.
I'd like to share with you a little bit Ping An is doing to fight against the COVID in the past 3 months. So next slide, please. Okay. I'm not sure how much of you know Ping An Group, so I just use one slide to basically give you some overview about Ping An. So Ping An actually is the world's largest insurance group, and it's ranked 29 in Fortune 500. And although Ping An is the largest insurance group globally, also it has very strong healthcare business built up in the past 5 years. So we call it Ping An healthcare ecosystem. So we divide them into 3 pillars: patient, provider, and payer. So from the patient side, Ping An has the world's largest mobile healthcare platform called Ping An Go Doctor. It has today 300 million registered users, and it has 700,000 daily consultations. So it's kind of the largest internet hospital in China and also in the world. And also as the largest insurance group, Ping An has over 200 million insurance clients for kind of healthcare insurance, life insurance, etc. And also as China government is the single largest payer in China healthcare ecosystem. So Ping An also serve over 200 cities in China to help with the claim processing related technologies. And also we have the provider business. Ping An is providing healthcare AI technologies like medical imaging, clinical decision support, disease management, all those functionalities to over 20,000 hospitals in China. So that's basically the healthcare business of Ping An Group. Next slide. Okay, so before I go to the details about the AI technologies for COVID-19 fight, I will just give you a quick kind of recap of the disease status in China. So actually, you can see the number of daily cases starting from January till now. So basically, China actually has gone through kind of 4 major phases of stages. The first stage by the late of January, basically China started lockdown of the Wuhan city and also home quarantine across the whole country. And by the end of February, people have to get back to work and life, right? So then actually China government released, we call it a process control policy called health code, which means every citizen will have a color coding to see, to identify the health status of the individual. For example, if someone has close contact with the confirmed case, like taking the same flight, the health code color for this person will be red. So if somebody kind of live in a highly kind of risk region, which has many kind of cases happen, then this person may get a yellow code. And the green code means this person is perfectly fine and he can go to work and go to restaurant and can do whatever they want, right? So based on this kind of process control, the number of cases actually dropped down dramatically, although China actually economy is getting back. But again, China actually faced another challenge, we call it import risk. which means confirmed cases from overseas travelers. So then China government actually started the control for those imported cases, like test every international travelers and also quarantine them for like 14 days, etc. So based on that, the number of cases from overseas travelers dropped dramatically. And now we are in the phase like kind of the full recovery of the economy and the life. Kids are back to school, and people get back to work. And again, based on all those control policies, you can see the number of cases keeps in a very kind of low level, but the economy is back like over 60%. So that's basically the status of COVID-19 in China. Next slide. So that slide shows the kind of the key topic I want to share with you today is about all the kind of AI related technologies we are developing for China. Slide 4, please. Okay, so basically we are doing three things using AI technologies. Number one is to help government with kind of better prediction. So the government can do better medical kind of resource preparation, and also can help them to do better screening and also prioritization of high risk population. That's number one topic. I will give you more kind of examples later on. Number two is to help hospitals, help doctors to do better diagnosis and treatment for COVID. As you know, this is a new disease in the world. So even doctors, they know very little about this disease at the beginning. So they need some help to do better diagnosis and treatment. Right? So the third thing we have been doing is to help citizens actually to know more about disease and also to do some kind of self-management, self-learning. Again, this disease is so new, so people are scared. They don't know whether they got infected or not, or what they should do when they feel kind of uncomfortable, right? So we provide this, we call it a chatbot, AskBob chatbot, actually to help citizens to do better self-management. Okay, so I will give you some detailed examples. Next slide, slide 5. So for the government, slide 5, please. Okay, so this is actually, I'm sorry, the GUI is in Chinese, but you can see most of them actually are charts, right? So for the government, basically we provide three things to them. Number one, they want to know, for example, how many kind of new cases would happen in the coming 7 or 10 days, or how many patients may get to recover in the next 7 days, right? So based on that, they can better prepare the doctors, nurse, beds, all those kind of medical resources for the treatment, right? So we provide this prediction, highly accurate prediction for the government, so they can do better medical resource allocation and preparation. Number two is from the kind of the spatial perspective, you can see that in the map we have some kind of a red zone, which means those kind of the highly kind of dangerous areas that may have kind of an outbreak in the coming 7 or 10 days. So which means the government or hospitals, they can pay more attention to those regions, for example, to do more tests or to kind of better monitoring or prepare more beds for those regions. So they can better kind of fight against the disease. So that's the second use case. The third use case is in the right part of the user interface, you can see a spider chart. That basically shows a risk profile we have built using the machine learning technologies. So we can identify the kind of high risk population, which means those people kind of are more vulnerable to this disease, and which means they need kind of high kind of better prioritized for either test for the virus test or prioritized for hospitalization, because this population has a kind of higher death rate, for example. So we provide these three kind of functionalities to in this case, Hubei province and some other province. Hubei province actually is the most kind of severe province in China in terms of number of cases. So we helped them to do better medical resource preparation and also better screening and help the vulnerable population to get better treated. Okay, next slide. Slide 6. Prediction is hard. So we need some technologies. Slide 6, please. We need some core technologies to do kind of better prediction. I don't want to go to all the details, but the key thing is we do kind of 3 types of analysis from the time perspective, space perspective, and also the individual perspective. From the time analysis perspective, we use the infection disease dynamic modeling technology, SIR, and the SEIR actually to predict the long-term trend. For example, when the number of cases reach the peak and when actually it will go down. So we use this technology to do the long-term trend analysis. And also in order to have an accurate prediction for the kind of the number of cases, number of new cases or the number of, for example, discharged patients in the coming 7 or 10 days, we need a more kind of a short-term prediction. So we use the time sequence analysis technologies to do this time sequence analysis and also some recurrent neural network technologies to do this short-term prediction. Another part is to do the space analysis. As you may know, actually, the disease in China starts from Wuhan city, right? So we build a spatial model to see, for example, the connectivity of the surrounding province or cities to Wuhan by analyzing the flight information, train, bus, and also the traffic, transportation, those kind of data. So we build a spatial model. We can see how the disease kind of propagate from the space perspective. And also we do this high risk patient profiling to find the more accurate kind of attributes for the vulnerable population. And also one notable thing to mention is, as Ping An has the world's largest mobile healthcare platform, so we have a lot of online consultations, and we find some interesting facts. For example, in certain city or region, we see kind of more kind of online consultation from patients, saying that they are kind of having cough and having fever and those kind of symptoms. And 3 days later, the number of cases, COVID-19 cases in those regions may also rise. So based on this kind of online consultation, we kind of provide some sensor of data, so we can detect those kind of early signals as early as possible. Then we can use that to do a better prediction. From the hospital perspective, the doctors, they need to do better diagnosis and treatment, right? So number 1 is we are providing a diagnosis tool for them, for those kind of CT imaging AI. Again, the golden standard for the COVID-19 diagnosis is through the virus test, right? But in many kind of regions, especially in China at the very beginning, we are lack of virus test facility. So we use a CT actually as we call it clinical diagnosis. We use that to help doctors to identify those kind of highly suspicious patients as early as possible, though they can get either quarantined or hospitalized to kind of prevent the infection, right? So here we provide kind of 2 major functionality. Number 1 is we can use AI to do more precise quantification of the lesion from the lung CT. This quantification is important because it's a critical measure to understand the stage of the patients. For example, if the percentage of the lesion is less than 5%, which means this patient is in the early stage, so that's not easy for them to take early treatment as early as possible. And if the lesion is like 20%, for example, it's already developed in the medium stage, and if it's the size is larger than 70%, which means is the patient is in very severe stage, they may need to get hospitalized immediately or even need to go to ICU. So we use this AI technologies to do lesion segmentation and also do this quantification to help doctors to better assess the patients, and then they can treat the patients in a more personalized manner. And another functionality we call it follow-up, which means if we can have a series of CT image of the same patients, then we can understand how the disease progress for this patient, whether the patient is getting better or getting worse. And we also, it's kind of the combination of the quantification and also the registration technologies. We can see how the lesion and actually develop for this particular patients, and then we can give doctors a more kind of actionable advice how the patient should be treated. Next slide, slide 8, please. So this AI, CT imaging AI has been deployed both in China and also worldwide. So in China, actually we have this Ping An Cloud. So we deploy the models on Ping An Cloud, and all the hospitals, they can connect their PAC system to Ping An Cloud and send their CT image to the cloud and get the results back for their doctors to do the kind of future diagnosis and treatment. The model actually has been used more than 60 hospitals in China. Over 200,000 patients has been diagnosed using this AI tool, and we help those 200,000 patients to get better diagnosis and treatment. And also, in addition to China, it also has been deployed in Europe and the US. In this case, we don't provide Ping An Cloud. We call it Ping An Open Platform, which means we work with the local partner in Europe or in US. So we deploy our models there, and then they can provide kind of this AI functionality to their local customers. So based on that, we can guarantee the data privacy, protection, all those kind of issues through a local partner. Okay, next slide, slide 9. Okay, another tool we provided to doctors or hospitals is a clinical decision support system for diagnosis and treatment, right? So again, this tool actually is divided into two parts. One part is for patient, another one is for doctor. For the patient, it's more like a symptom checker, because the citizens actually, they are very nervous. So they don't know whether they have some symptoms like fever, cough, or something, or sniffing nose, for example, whether he or she got the COVID or not. So we provide this symptom checker through a mobile app. So the patient actually, they can answer those questions and provide some information, data like the fever, his fever or her fever, for example, and also the travel history and the symptoms, etc. So our symptom checker will do kind of assessment how likely he or she may have COVID, because we don't want to encourage people go to hospital because hospital actually very likely people may get infection in the hospital. We want to reduce unnecessary hospital visits as much as possible. So we use the symptom checker first to help the people to decide whether he or she need to go to hospital or not. So using our tool, actually, we identified 5,000 cases, which means they are highly kind of risk citizens, and they need to go to hospital immediately. And the second tool we provide is for doctors. Again, this disease is so new, so doctors, they don't know too much at the beginning. Actually, the MOH of China published the clinical guidelines for COVID diagnosis and treatment, they upgraded the guidelines 6 times within a month. So you can see that there are so many new knowledge the doctors they need to learn. So we build that into our clinical decision support system, which means when the doctors in their electronic medical record system, when they input some information like the symptoms or some social history of the patient, we will pop up some possible diagnosis, and we have COVID-19 there. So we deployed this clinical decision support system in over 15,000 primary hospitals in China, which means the doctors there, they can get kind of real-time recommendations from our system whenever they meet a kind of high-risk COVID patient. Our system will give the doctor immediate recommendation or reminder to avoid misdiagnosis. Okay, next slide, slide 10. To develop this clinical decision support system, we have a kind of, we call it the combining knowledge-driven and data-driven methods. Why? Because at the beginning, we don't have too much patient data. So we build this knowledge graph. So we use the knowledge-driven approach. So there we have the symptoms, lab tests, diagnosis, treatment. We have all those kind of knowledge encoded as a knowledge graph. So the machine can do kind of reasoning on top. So they can provide a diagnosis and treatment recommendation. But later on, after we have more kind of patient cases data from the electronic medical record, we develop this deep learning based data-driven diagnosis tool. So then we use an ensemble kind of way to ensemble the diagnosis and treatment recommendations from both knowledge graph and the deep learning models, so we can improve the accuracy of the diagnosis by combining the knowledge-driven and data-driven methods. Okay, next slide, slide 11. Okay, so this is some tools we provided for citizens. Again, this disease is so new, so other people kind of get scared, and have a lot of questions about, for example, what are the kind of symptoms of the disease, what drugs are more efficient, or even some people developed some mental health problems. So here we provide a chatbot app. So the patient actually, they can ask all kinds of disease related questions. I'm sorry in Chinese, but for example, the first question is about what are kind of the major way to get infected, and how can they prevent that. So we have these answers by working with the reputable hospitals and experts in this area. So we give the general public the most trustworthy information about all the disease-related questions. Again, we don't have doctors that answer those questions through phone call. We just use this chatbot, so it can cover the majority population in China. And if we find, for example, some patients are high risk, then our system will kind of redirect the citizen to hospital or to some online doctors, so they can get kind of more better kind of specialized specialist services. Mental health problems is another thing, because people get quarantined at home, so they are getting more and more nervous, and also some of the citizens actually, they have families like doctors working in the frontier, right? So they worried about their family members. So we provide this mental health assessment tool for them, so they can do a quick assessment of the mental health status. And also if we find some kind of people with very kind of severe situation, we refer those patients to to a psychologist platform we have. So we have 300 psychologists in that platform, so they can do kind of a further follow-up with the patients to help them to address their mental health issues. Okay, next slide. Some of the key technologies behind the chatbot. Again, I don't want to go to each box, but the key thing is from the technology perspective, number one, you need to understand what the patient is asking. So there you need some deep semantic matching technologies, because natural language is very kind of unclear. So people ask same questions in many different ways. So we need the semantic matching technologies to understand the true intention of the patient's question. Again, actually in ACL MediQA last year, our technology won the competition. It is the world largest natural language processing conference in the world, and the key competition is to do the patient question intention analysis. The number two is to do the QA. After you understand the intention of the patient, and you need to give the accurate answer to this patient question. So here we use all kinds of machine learning technology, deep learning technologies to find the answer from the knowledge graph we have. So we use that technology to give the kind of the answer recommendation to the patients. In EMNLP, which is another large natural language processing company, last year we also won the competition. Number one in that context to basically do the knowledge graph-based QA. This is something new. We are just working on that for drug discovery. So as you may know, so far we don't have a vaccine and the effective drug for COVID-19 treatment. So inspired by a recent work published in Cell Journal, so the deep learning technologies has been used to discover a brand new antibiotic drug by scanning 100 million molecules within 8 hours. So using a big kind of a deep learning platform. So we are also working on that technology using SFE, we call it SFE platform. So it's an AI platform to do automatic work search, model inference, all those kind of AI technologies. And we have the drug discovery library on top. So we are running our drug discovery algorithm over those 100 million molecules to see whether we can find some relevant chemical structure to fight against this disease. Okay, so because of time, I will stop here. Again, given the disease will be there for quite a while, and we don't have kind of effective vaccine and the drug at this moment. We have to live with the disease for a while, unfortunately. So hopefully all those AI technologies that Ping An Group has been explored could be beneficial to China kind of citizens, and also can share some experience with our global colleagues. Okay, so I will stop here to see any kind of questions, comments.
Thank you so much, Dr. Xie. Unfortunately, we've run out of time, and while there are way too many questions to go through, we will not have the time for the same. That's a real shame. I think for attendees, if you want to get in touch with Dr. Xie, there's a contact available in our ebook, and I think that's probably the easiest way to reach out to him. Dr. Xie, thank you once again for that enlightening presentation. I can definitely see from the flurry of questions that this is definitely proven very, very helpful to a lot of our listeners. So thank you so much.
Okay, thank you. Thank you all for your time and attention.